Now I'm going to deliver blood to my upper limb. I'm going to deliver it using this heart on this side. And then I'm going to bring it back using this heart on this side. Do you have two hearts for those two jobs? No, but it's going to look like a spaghetti mess anyway, so we might as well separate out our arteries, which are taking blood, feeding the limb, and our veins, which are draining the limb. So let's start with our arteries, and let's do, let's just clarify that we're doing them on each of my different hearts. Keep in mind also that right side and left side are different in the arteries. So it's not symmetrical. So I'm going to highlight the pieces that are unique. First of all, who's the vessel? Blood is going to come out of the left ventricle no matter what, and it's going to travel up the ascending aorta. It's going to start into the aortic arch, and we have two branches that we can go to if we want to feed the right arm or we want to feed the left arm. That's an L. If we want to feed the left arm, we're going to take the last branch, and that is the subclavian, the left subclavian artery. And that's all I'm going to tell you about the left side. Everything else I'm going to do is going to happen on the right side. So as soon as you see me draw the right subclavian artery, that's the point at which left side and right side are now identical. You know that my first branch off of the aortic arch is the right subclavian artery. And I'm going to highlight, this is going to be kind of stretched out because we don't actually have a body there, but this is the right, excuse me, this is my brachiocephalic artery. And my brachiocephalic artery stays brachiocephalic until we have a branch. And the branch that comes off, and I'm indicating my junctions with circles, just so that you know that it's just a tube, but we're going to have a branch that comes off. And the branch that I'm going to come off, one of them, is going up. Where's it going, doggies? It's going to the head. So I'm going to draw it in green so that you know that this isn't a vessel that's actually feeding the arm, but it marks an anatomical location where our vessels are going to change names, which is why I'm including it. It feeds the head, and this is the right common carotid artery. So the right common carotid artery branches off. At the point where the right common carotid branches off, the vessel now has a new name. Now it is called the subclavian. The right subclavian artery. Check it out. Here's my left subclavian artery. Here's my right subclavian artery. Now we're symmetrical on the right and the left sides. The right subclavian artery is so named until you reach the lateral border of rib number 1. I'm going to indicate such, it is a junction, but it's an anatomical distinguishing mark. It's not distinguished by a branching vessel. So it's the lateral border of rib 1. And at that point, oh, lo and behold, fascinating amazingness, we get a new name. Now this vessel is called the axillary artery. And the axillary artery travels until it reaches another structural location. And this one is kind of odd, so it's not odd, it's actually kind of exciting because it marks review of a muscle that we all know and love. The axillary artery changes when it passes the inferior border of teres major. So if you're in cadaver land and you identify teres major, that's the place, that's the place where the axillary artery is no longer considered the axillary artery and instead is the brachial artery. So let's make sure that I'm got my right colors going on. Now we're the brachial artery. No need to write artery out. We can write A. All right. The brachial artery has clinical significance because that's where you listen when you take someone's blood pressure. So the brachial artery exists all the way down the arm until the cubital region. And the cubital region is basically your elbow pit. It's the anterior portion. Here, that's my, see my elbow? Hi. It's the anterior portion. It's where you give blood in the cubital area. So let's just make a note of that. This is the cubital region or area of your arm. And at the cubital region, the brachial artery branches into two other arteries. So, we'll go like that, and then we'll branch out, because it's always good to branch out. So is it clear that I'm saying that the cubital region is where the brachial artery branches into two other arteries? And if you had to guess, you are now in the forearm. So go ahead and guess, like, what would be the easiest name for the lateral branch of the brachial artery? How about if we just call this thing the radial artery? Oh, but of course, and if the lateral branch is radial, what's the medial branch? The ulnar artery. Okay, super cool. Clinical significance, radial artery is where you most commonly take a wrist pulse. You can feel the pulse in the ulnar artery as well. You have to be calmer and more sensitive. It's always good to be more sensitive. I think that's awesome. You now have blood to your hands. Do you think there are other arteries in this mix that are feeding specific places? Yeah. There are branches coming off here, like little tributaries that are going off, like billions of them. And many of them have names and feed specific structures. So please understand that I'm leaving out a whole bunch of details, but I'm giving you this big picture. And now you can imagine holy capillary bed has taken place. We've exchanged nutrients. We've taken out the oxygen. We've dumped in the carbon dioxide. And now we need to come back. If we're going to come back, let's come back through the veins. The interesting thing with veins is that they are highly variable, which means, it means that the anatomy of veins differs, especially superficial veins. It differs significantly from person to person, which makes it, of course, a little more challenging to pin down details. Like there's more figuring out depending on the person that you're dealing with. So keep that in mind. The other interesting thing about veins, and this is true for arteries as well, but veins, we have superficial veins, like the veins that you actually can look on your arm or your arm is a great place to look for superficial veins. They're close to the surface of the skin. And if you think about that, I mean, this is a good conversation to have. Why are your arteries, you have some arteries that are deeper than other arteries, and you definitely have arteries that pass through a relatively superficial area, but in general, we try to avoid letting arteries come to the surface of the body. Why? Well, your artery is the closest to the heart as far as the pressure of the heartbeat fueling the blood flow through the artery. So if you whack an artery, you're going to have the heart actively like pushing blood out of that artery. It's that spurting, like if you see somebody who whacked an artery, the blood doesn't just flow out, it spurts out. And it's spurting out because your heart is pumping it. Whereas if you cut a vein, you went through the whole capillary bed, and the blood is slow. It will ooze out. Even if you cut a giant vein, you have a better chance of surviving a giant vein slicing than a giant artery slicing, because your heart will make you lose your blood faster. That would suck. What was my point? Superficial veins versus deep veins are important, and my little patterns, this pattern is pretty consistent. My little patterns over here are going to be slightly variable. So I want to talk about superficial veins first, and I'm going to make my superficial, that says superficial. I'm going to make my superficial veins lighter and then my deep veins darker. And that's just going to be my little color coding so that you know who I'm talking about. We got to start at the heart with the arteries. We're going to start in the limb with the veins. And I'm doing it that way. Even though it's hard for me to visualize this, it's hard for me to start drawing it because I want to start here and go backwards. But blood is flowing from your hand back up. So there are two superficial veins that I want you to be aware of. There are two deep veins that mirror these guys. We do have a radial vein and an ulnar vein, but they're deep. So these guys are superficial, so don't be distracted by that. You have, I'm going to keep my cubital region about the same level so that you can have a perspective of like where these things are happening. And the lateral vessel, superficial vein, is called the cephalic vein. And it's a superficial guy. And it travels all the way up. And I'm going to finish my adventures with the cephalic vein because it's actually going to, where it dumps in, I want to make sure that I can't decide where I want to put that until I get the rest of this filled in. The medial superficial vein is the basilic vein. And remember that we also have deep veins. We have the deep radial vein and the deep ulnar vein. The basilic vein travels medially, and there's another superficial vein that's super important and significant, and that is the median cubital. The median cubital is a branch that connects cephalic and basilic, another superficial vein. The reason why this one's important and these three are important is because the median cubital vein is a site of blood draws, a common vessel to try and poke to get blood out of you. When you give blood, most often they're poking the median cubital vein. You can see it. You can see it. It's also in your elbow pit, the cubital region. That's a nicer way of saying elbow pit. All right, so all superficial. Now, I'm going to draw a deep artery in here, excuse me, a deep vein, because there is a brachial vein. I want to make sure that I get this. We'll do it like this. And do you see how I'm drawing like dark blue? And the brachial vein splits, and it actually becomes two brachial veins. And I think that we do need to know the brachial vein. And it's darker because it's deep. The reason why we need to know it is because the place at which the basilic vein joins the brachial vein is the mark of a new vessel. And the new vessel is, what would you guess? Brachial vein joins with basilic vein to form, who are you going to guess? The axillary vein. Now, the axillary vein We know that after brachial vein combines with basilic, that's when it's named axillary vein. Axillary vein, the cephalic vein, flows into it. And I'm not going to put, we don't change its name. This whole thing is the axillary vein. So cephalic flows in at the point, exact same point of this whole thing, at the lateral border of rib number 1, we turn into the right subclavian vein. Now, I'm completely out of room. In fact, I might just get rid of these guys. Goodbye. And you already have these notes written down, right? So I'm just going to get rid of all that. So I have a little more room because we now have the right subclavian vein. The right subclavian vein at the point of, okay, look, this is why this is important, and I'm completely out of room. So here is a branch of the jugular vein. Ay, ay, ay. Ay, ay, ay. Oh, I see what I did. The jugular vein flows in and joins the subclavian vein. And when that happens, they both become the right brachiocephalic vein. And the right brachiocephalic vein, hold on a second, I got to write all that down. The jugular vein from the right side of the body flows in and joins the subclavian vein and becomes the right brachiocephalic. That says brachiocephalic vein. It does. The right brachiocephalic vein and the left brachiocephalic vein. That means brachiocephalic vein from the left side, which has the same pattern. They join together to form whom? Whom are we now? Now your superior vena cava. Do you think you need to draw this yourself again? I wish I would have spread this area out. Can you see why my little brain wants to draw the picture out of the heart and why I'm trying really hard to avoid that? Because I don't want you to think that blood is flowing in that direction. Blood is flowing back to the heart in our veins. All right. I think you guys are fantastic. Now, let's go talk about the brain.